Over the past 20 years, society has become more aware of the devastating and lingering impact of trauma, violence, and abuse on survivors. Physical, sexual, and psychological violence occurs in homes, schools, and communities, disrupting individual lives and weakening the fabric of our society.
While violence, trauma, and abuse affect men, women, and children across the lifespan, some groups, like women, children, and people of color, are statistically more likely to be victims. We know that too many Charlotte girls are victims of teen dating violence, sexual abuse, and domestic minor sexual trafficking during their adolescence.
Nationally, 1 in 5 girls experience sexual abuse before 18. In Charlotte, North Carolina, 12% of high school girls report sexual or physical dating violence. This is double the rate of boys, while Latina girls report the highest rates of physical and or sexual dating violence.
North Carolina is often cited as a top 10 state for domestic minor sex trafficking, or DMST, which involves the sexual exploitation of young people for money. Alarmingly, 50 to 90% of young women engaging in DMST were involved in the child welfare at some point.
We all go through difficult experiences during our lives. However, traumatic experiences are different because of our typical ways of coping are not adequate. When we lose our ability to cope, our problems become even greater. Let's try to understand what it means for an adolescent girl in Charlotte by considering the experiences of Lucy.
Lucy is 15. She is a good student and plans to be a doctor. Last night, her dad came home drunk again and beat up her mother. The police were called and her dad is in jail. Lucy, her mom, and brothers will now live in a single room of her aunt's apartment far from their current neighborhood.
Even after the trauma is over, many survivors struggle to feel safe in their own bodies, to regulate emotions, and to trust other people, including people who may want to help them. All too often, adolescent girls have experienced cumulative or many different types of trauma. Cumulative traumas can lead to even more complex and persistent difficulties.
Lucy has not been able to make friends in her new school. Bad dreams keep her up at night. She worries her dad will come back to hurt her mom and that she won't be able to take care of her brothers. Lucy hasn't told her mom about the nights her dad came to her room drunk and molested her. She doesn't want anyone to know about that.
Compared to other girls, trauma survivors are at risk for a number of problems that affect their future. They are more likely to experience school failure, mental health problems, substance abuse, running away, and teen pregnancy. For example, Lucy failed her science exam and thinks she might drop out of school and get a job.
Recently, she started smoking weed with other kids who live in the same apartment. It feels good to not have to worry so much. An older guy comes around. He listens to Lucy talk about her problems. He wants Lucy to be his girlfriend. He wants to buy her new clothes. Lucy's aunt tells her this guy is bad news.
Positive experiences successfully launch adolescents into productive careers and relationships. Unfortunately, research suggests girls such as Lucy are more likely to be victimized, suffer chronic health problems, and live in poverty as adults. Violence, trauma, and abuse are often part of an intergenerational cycle. Communities must respond decisively to help break these cycles.
Here are some ways that our community can better help girls like Lucy. First, we need to improve local data systems. Violence, trauma, and abuse are hidden problems. Without data, we don't know how widespread the problem is and won't be able to tell if our efforts to improve things are working.
Girl serving agencies should recognize that many girls have experienced trauma. Providing trauma-informed services means that organizations strive to meet survivors' individual needs. Programs should work hard to avoid further trauma by giving survivors more choice and control and by training staff to understand and respond to trauma.
Programs and policies should seek input from diverse girls. Survivors should be helped in ways that reflect who they are and what they need. Programs should reflect diversity in gender, age, race, ethnicity, sexuality, and other important identities so that the girls and their families feel comfortable seeking and receiving help.
Finally, our systems need to work together to benefit girls and families. Charlotte girls may find themselves interacting with many systems. including law enforcement, child welfare, and mental health providers. Each of these operates with its own priorities, rules, and requirements, and sometimes these conflict. Better outcomes can be achieved when everyone collaborates to enhance girls' health and well-being.
So what can you do to help? First, you can treat everyone you interact with the sensitivity and kindness you would a trauma survivor. That is the fundamental principle of trauma-informed care. You can volunteer locally with organizations that are working to eradicate violence, trauma, and abuse. Volunteers provide essential support, advocacy, and community education. Finally, consider joining the Women's and Girls Research Alliance Working Group on Trauma, Violence, and Abuse. This group will focus its efforts on making change in the Charlotte-Mecklenburg area.
Now that you have heard the story of Lucy, join us in making Charlotte a safer community for girls. Thank you for your time today.